Jeryl, if you want to go ahead and help us out with the background on some of the issues that we'll be lobbying for.
Great. Thanks so much for teaming up for that great overview. So now at this part of the presentation, we want to kind of provide just a quick background of information about the Hyde Amendment, about abortion coverage and the Affordable Care Act, and then more specifically about legislation that's related to insurance coverage for abortion, including the Each Woman Act, which you will be lobbying on. So just to give a quick background about the Hyde Amendment and what it is, this picture here is of Congressman Henry Hyde, who was from Illinois, a Republican from Illinois, who in 1976 proposed an amendment that restricted the use of Medicaid funds for abortion. So as is quoted here, he remarked that he certainly would like to prevent, if he could, legally anyone having an abortion, a rich woman, a middle-class woman, or a poor woman, but unfortunately the only vehicle available was the Medicaid bill. So Congressman Hyde clearly wanted to restrict access to abortion for all women, but found that his best option was really putting restrictions on women who were receiving public health insurance. So each year, the Hyde Amendment gets renewed by Congress as part of their annual budget process, and what the Hyde Amendment currently restricts is the use of federal funds to be used for abortions, except for in the cases of rape, incest, or to save the life of the mother. So around the time, around the time that that the Hyde Amendment was first being proposed, Justice Thurgood Marshall, who is on the U.S. Supreme Court, said in 1980 that the Hyde Amendment is really designed to deprive poor and minority women of the constitutional right to choose abortion. And we see that the Hyde Amendment, is applied not only to federal coverage for Medicaid recipients, it also includes other groups, including those who are covered under the federal employer's health benefits, those who are part of the federal prison system, those who receive their coverage under the Medicare system, and also patients who get their coverage through TRICARE, which covers members of the military and their dependents. So the Hyde Amendment has a pretty wide range of folks who are impacted by its restrictions. So this graph just gives you kind of a look at states and how the state are responding with. Some states do, because of either through their state constitution or through other statutes, they do provide coverage in those circumstances. But please note that, providers definitely report that even though these states do provide coverage from their state taxes, that they still have trouble getting reimbursed in some states. The majority of private plans do cover abortion, although many women express difficulties in being able to access that care. Some say that they aren't even aware that their insurance plans cover abortion, and some may have private health insurances with high deductibles in order for them to be able to be reimbursed, and therefore have to end up paying for their abortion out of pocket. Also, given the stigma that still surrounds abortion, some women who do have insurance coverage in their policies may decide not to pursue insurance coverage through their insurance, or because their employer or primary policyholder may find out about the abortion. So even in places where women's insurance may cover abortion, there may still be stigma or other reasons why women don't access abortion through their health insurance. So with the passage of the Affordable Care Act, there are now some different restrictions on insurance coverage of abortion. Through the Department of Health and Human Services, the ACA prohibits them from identifying abortion as an essential health benefit. So the HHS was tasked with identifying a portion of these benefits that every insurance plan sold in the marketplace must provide, And unfortunately, the ACA prevented HHS from even being able to define abortion as a essential health benefit, which means that plans do not have to cover it in the way that they have to cover other sets of essential health benefits. The ACA also allows healthcare providers and facilities to refuse to provide, pay for, cover, or even refer for abortion. So this provision, also incorporates federal refusal provisions, which further separates abortion care from other health services, which means that even if a woman's health plan covers abortion care, her provider can still refuse to provide the service or even refuse to provide a referral to someone else who will. And finally, the Affordable Care Act also allows states to ban abortion coverage in the insurance marketplaces. So just to look at sort of where women get coverage, get health insurance coverage in general, we see a large portion of women get their insurance through their job. Some women get their insurance because they are dependent on someone else, so they're either their spouse's insurance. And then we do see a large portion of women who receive their coverage through Medicaid or through other government funding. And at last count, kind of looking more specifically to the Medicaid coverage, Medicaid covers almost 70 million Americans, which is more than 1 in every 5 at some point during the year. So it is a pretty big portion of how Americans receive their coverage. And so because Medicaid is administered by the states within a broad federal requirements, states and the federal government, finance the program jointly. So because of, the way that the federal government is working with state governments to define regulations of Medicaid, there's a lot of influence that policy and legislation can come into place in terms of placing restrictions then on what Medicaid covers. So as many of you may have heard, when the Affordable Care Act was first implemented, there was an expansion of the Medicaid program that was to expand the access of coverage to a larger percentage of uninsured Americans. Unfortunately, because of the way that the Supreme Court came down, that provision of the Affordable Care Act was not enacted, and so it then became it was on states to decide whether or not they wanted to expand coverage. So there were states that decided to expand coverage and increase the number of citizens who are then eligible for Medicaid. And as many of you are aware, there were plenty of states that declined to expand Medicaid coverage. So for the most part, the Medicaid expansion was pretty great in that it did allow more and more citizens to be able to get health insurance coverage. But one of the negative impacts of the expansion of Medicaid eligibility was that it also increased the number of people who would then be potentially impacted by the harmful Hyde Amendment restrictions. So in addition, because of the Medicaid expansion and looking at, the ways in which the Affordable Care Act was influencing how abortion was being covered by, potential insurance coverage, there has been quite a bit of legislation proposed to restrict access to abortion with through insurance. So this map shows different state bans on insurance coverage of abortion. So the states in black are states that have a specific ban on insurance coverage in all private plans in the state, including those that are part of the marketplace. The dotted states are states that have a ban on insurance coverage only in the state-specific insurance exchanges. And then the white states are states that don't have additional state bans, although the federal ban on public insurance, so federal funding, are still in place. So finally, we're going to turn to the specific legislation options, including the Each Woman Act, which is pretty exciting. So the Republicans have really, and those who oppose access to abortion, in response to the expansion of Medicaid and looking at different ways that they want to really make sure that even as insurance access gets expanded to patients, to make sure that abortion did not get expanded with that coverage. So there have been a number of bills, misleadingly titled bills called the No Taxpayer Funding for Abortion and Abortion Insurance Full Disclosure Act that have passed through the House on a number of years, would basically ban coverage of abortion in the insurance exchanges, would penalize small employers who provide health plans with abortion coverage by imposing large tax penalties, would prohibit individuals from using health savings accounts or flex spending accounts to be able to pay for their own abortions, and would have basically the effect of taking away existing abortion coverage for millions. And in part because a majority of private plans already cover abortion, people just may not be accessing that coverage, and so they really wanted to do as much as they could to try to restrict access to those plans. For the first time, though, on a positive note, legislators have been able to introduce a proactive bill to really pivot away from the bans that have been in place. So the Each Woman Act, which stands for the Equal Access to Abortion Coverage in Health Insurance, Act of 2015 was introduced last July by Congresswoman Barbara Lee of California. The bill currently has over 100 co-sponsors in the House. And really this bill's introduction followed years of groundwork laid by different coalition members to really provide lawmakers with better language and framework for talking about the Hyde Amendment and insurance coverage for abortion, including shifting away from language like, Hyde is a law in the land, or there's no federal insurance, or there's no taxpayer funding for abortion. And while there is not yet a Senate version, we do anticipate introduction on the Senate side very, very soon. And so, just more information on the Each Woman Act. It really served as sort of proactive legislation that was a counter to HR 7, which was the No Taxpayer Funding for Abortion bill, and as sort of a pivot point away from the sort of Hyde is the law of the land language. What it does specifically is to set the federal government as a standard bearer to ensure that every woman who receives health care through the federal government has access to abortion. And it would also prohibit political interference with decisions by private health insurance companies who provide abortion coverage in their plans. So the Each Woman Act would basically restore abortion coverage to those who were enrolled in the government health insurance plans. So that includes Medicaid and Medicare, and those women who live in the District of Columbia. It would also restore coverage to those who were enrolled in government-managed health insurance programs. So those for folks who were employed by the federal government. And also, it would restore coverage for those who receive health care from a government provider or program. And that would include Indian Health Services, the Federal Bureau of Prisons, the Veterans Administration. So a wide variety of folks who also receive care through the federal government. The prohibition on political interference in the private plans would basically ensure that federal, state, and local legislators would not be able to interfere with the private insurance market, including those insurance marketplaces that have been established by the Affordable Care Act to prevent insurance companies from providing abortion coverage. So basically making sure that private companies would not leave women without options to have abortion covered under their private plans. So that's the sort of basics on the Each Woman Act. So we've got some specific talking points for you to take into each office. So if you are speaking with a pro-choice office, some of the talking points include saying things like a woman's health insurance should cover all of her health care needs, no matter where she gets her insurance or where her income is, or what her income is. We know that 1 in 3 women will have an abortion by the age of 45, so this should be covered. This should be considered basic care that is covered. Coverage restrictions for abortion ignore the very real situations women face and have a devastating impact on their ability to access safe and legal abortion care. And for a woman to be able to make a decision based on what's best for her and her circumstances, she needs to be able to afford her care. We need to expand coverage, not limit it. For these pro-choice offices, one of the other things you might want to just mention is that, you know, given all of the current attacks that we're seeing on access to abortion, that now is really the time to be increasing our congressional support for abortion coverages, not shrinking back from it. So for offices that may be considered mixed choice, so for those who have, you know, that sometimes vote for pro-choice measures and sometimes vote against, you kind of want to stick with messaging that is more along the lines of however we feel about abortion, we should not deny a woman health coverage because of how much money she makes or where she lives. That when a woman needs to end her pregnancy, it is important that she has access to safe medical care, and providing insurance coverage helps ensure that she will be able to see a licensed quality health provider, and that denying insurance coverage for abortion could put a woman's health at risk. And this is really where, as you know, medical students and future medical providers really talking about the safety and wanting to make sure that women have options and have access to safe care is a really solid place to be for mixed choice offices. And finally, if you do have, you know, meetings with anti-choice offices, you know, the main thing is really to be respectful. We know that you know, it'll be a hard challenge to have them to come to our side, but really just being positive and focusing on your experience. There may be some potential questions that you may get from different offices, so we just wanted to provide some information in case you get those questions. So a question you may be asked is, when will the Senate bill be introduced? Again, Senator Ferrano from Hawaii hopes to introduce the Senate version of the Each Woman Act in early 2016. As I mentioned, the bill has over 100 co-sponsors in the House, and we really hope to see it introduced in the Senate with strong support. If you get the question, does this bill eliminate restrictions on abortion in the Affordable Care Act? The answer would be that the bill would impact the ACA by preventing states from banning insurance coverage for abortion in their marketplaces. Instead, insurers would be able to decide for themselves whether to include abortion in their health plans. Other restrictions would still remain, for example, like not having abortion covered as an essential health benefit, and having at least one plan with no abortion coverage, which does guarantee a choice for consumers who are opposed to abortion. Other potential questions you may get, a lot of my constituents are personally opposed to abortion and don't want their tax dollars paying for it. Why is that wrong? Our response is that many people have strong feelings about abortion, but I don't think any of us can make important life decisions for someone else. When health insurance covers all healthcare needs, including abortion, a woman can make the decision that is best for her and her family, and we should interfere with a woman's decision just because she is poor. Restrictions on abortion coverage have a disproportionate impact on low-income women, women of color, immigrant women, and young women. This is not fair. We find that using a fairness aspect really resonates with a lot of offices, particularly for those mixed choice and sometimes with the anti-choice offices. And finally, a potential question may be that, you know, Hyde has been in effect for nearly 40 years. Why should we change it? The health care that a woman receives should not be determined by the amount of money she makes or where she lives. Politicians should not interfere with a woman's ability to make her own healthcare decisions. And for 39 years, these coverage restrictions have been in place, but those restrictions are both unfair and unjust. Fortunately, 15 states provide coverage beyond the Hyde restrictions. Hyde is not and should not be the law of the land. So we really wanted to harp that even though it has been in place for all of these years, it's been in place unfairly, and that we really need to change these restrictions. And then, without restrictions, won't there be more abortions? A woman, should be able to make the decision that is best for her, and it makes sense that health insurance for women, regardless of the source, should cover birth control and abortion, and not just childbirth, because when people can plan if and when to have children, we all benefit. And then finally, is Planned Parenthood violating Hyde on using taxpayer funding for abortion? And the short answer is no. And while we may disagree with laws limiting federal funds, abortion providers fully comply with them. But let's be clear, cutting funding for Planned Parenthood means decreasing access for preventative services like birth control, cancer screenings, and sexually transmitted infection testing and treatment. Family planning options allow women to have children when and if they are ready and reduces unintended pregnancy. This is the best way to ensure healthy families. So just to go back over the specific asks, so for health offices, if they are already a supporter of the Each Woman Act, you really want to say thank you for your support of the Each Woman Act, and please continue to champion women's access to insurance that covers abortion. And for pro-choice offices that are not already on, you'll want to ask them to please co-sponsor the Each Woman Act, which is HR 2972, in case you get asked the bill number, and oppose insurance coverage for abortion. For Senate offices, you have pro-choice offices, please support the introduction of the Each Woman Act in the Senate later this year, and please vote against measures that restrict insurance coverage for abortion. And if you're meeting with mixed choice offices, please vote against measures that restrict insurance coverage for abortion. And then I have my contact information here, that if you have questions about any of the information that was presented, please don't hesitate to reach out and contact me. I know it was a lot of information in a short amount of time, but as Pratima indicated earlier, you're not expected to be experts on the specifics of the policy. You are expected to be experts in your experience and the areas that you have expertise in, and that's why staffers really do enjoy meeting with medical professionals because you do provide a different viewpoint, and your insight is very valuable to offices. So thank you.
Well, thank you both so much for joining us. I really, really appreciate your expertise and you taking the time to speak with us on these issues. So thank you, and thanks to everybody who's tuning in. Advocates who will be joining us on the 31st. Definitely check out AMSO's Lobby Day website